All right, let's go live then. Happy Friday, everybody. I wanted to go through some updates. We're still adding more and more businesses that are getting through the licensing process and getting Medicaid approved. These are clinicians around the country that are using Optonome to guide them through this many steps to start and then scale their business providing quality care. This type of standard that we're creating really gives peace of mind to individuals in your local communities as they need long-term care. Because these businesses are led by clinicians, they went to school for it, they've worked many years in the industry, they actually care and want to be around for the long term. It's their career. So we recently added Flourish Community Services in Pennsylvania. If you scroll down, you can also see Flourish on the drop pin there, led by Abby in the Wynwood section of Pennsylvania, and um, currently approved through the autism waiver and soon to be consolidated waiver. These are different waivers, like many waivers in many states, that uh, allow those that have different disabilities to receive long-term care as part of the home and community-based model that more and more people are starting to be aware of, the opportunity to actually receive value-based care in their home or community setting. They don't have to stay in an institution because of their disability. And more seniors are seeing it as well because until now, nursing homes, or until recently, nursing homes were the only option. Now there's more funding, or at least money follows the person, initiatives to bring more awareness and allow those that do want to transition out of a institutional type setting to receive care in a home or community of their choice. So the whole point of the autonomy application is to really help those individuals and their families, the many millions of families, or, to really be able to receive the training, be able to communicate, assistance, anything that they choose, the tools that they need to care for their family members. Right? But also knowing that in their back pocket, they also have a clinical network where they're also using the same application to provide services to those in need as well. And so those that are supporting their family members, they at least know that they have a tool that's free to use, it's continuously audited by Medicaid, Medicare officials, and if they need help or assistance, they can get that, or at least assistance in receiving training to become an RBT, um, to become a DSP, to be a program specialist, and additionally, even become a clinician. Because each CEO of each business using autonomy, providing home health care is a clinician, you automatically have that mentorship built in. They want to motivate you to do better at the point of care, uh, to receive education and become an expert in delivery. Right? So the autonomy app is really helping those DSPs at the point of care. At the point of care, it's really important there. And so what I recently introduced is the AI aspect within channels. As a chat application, and the ability to find activities in your local area, add them to your map. You can also in calendar, you can we're giving you the ability. It will be limited because the application is free for the general public, but you can at least start to test out in an easier way uh, and ask different questions to this to an autonomy AI assistant. We call her Quinn, and you're able to ask just about anything right now. And it's extremely bright, and as far as helping a DSP be more insightful about and have answers to simple questions, this type of assistant is really helping. Will help the DSPs at the point of care, not only bringing up conversations, but also bringing up additional, giving giving them the ability to bring up additional tasks or things to do. Here's an example. We asked Quinn to show us how to make a peanut butter and jelly sandwich, and that breakdown was definitely there. And at the same time, it can be broken down even further to prompt an individual that's looking to become more independent, right? And um, at the same time, if we want to ask additional questions to the chatbot, you're also able to do that as well. And so, because these channels are private, only when you prompt the bot is when that data is captured. No other data is shared. These are extremely private, in HIPAA compliant servers. So the data that you only submit within and discuss with Quinn is considered non-HIPAA compliant. All right, I would consider this type of information non-HIPAA compliant. You don't want to. You only want to put information in here that is generic, or you don't mind it being shared. It's not going to be shared within the autonomy application at all. But as far as if you ask it like questions that could be detrimental to society, something like that, you could spark a red flag to certain officials. So I would definitely caution there. But as far as families coming up with topics, being very creative with their children, these types of simple questions or even more advanced questions around storytelling or even math problems or anything related to schoolwork, it could really help family members um, have talking points or at least help them with quick ways to brush up on different skills. I really think it can help different families. And since the layout of autonomy is in channels, you're also able to save and divide and search and separate the different topics to your liking. Um, and again, it's customized to your liking as well because it's in these private, secure, HIPAA compliant channels. And within each channel, again, you can invite different people to them. You can share the channels, but only with specific people. So please, as we continue to roll out um, the AI features, please, you're able to small businesses can use autonomy, and as we roll out the different AI features, they'll be able to use it in the different aspects of their business, like marketing, or even um, questions around hiring. We'll continue to customize the different versions for you all, especially around tax questions in your state or locality. There are so many questions around that, but our goal again is to help the small businesses that use autonomy and help them really scale and focus on what they do best. Um, and those clinicians that are up and running, they're doing a great job. And please, when you get a chance, send them a chat message and autonomy application saying thank you, or at least give them a kudos or like on one of their public channels. All right. Thank you. And please download the autonomy application.